We are scrolling through a 19-year-old with a JNA, a juvenile angiofibroma, a pretty big one at that. And for you core takers, for you board takers, for you residents and fellows and young radiologists, who gets these? Males, a high preponderance of males. You're going to get asked this on an exam. And what age? Well, juvenile is in the title, so going to be juveniles. That's no secret. About 15 years of age. Our patient is 19 years old. Let's focus on some anatomy right now and the epicenter of where these lesions arise. I'm going to start out with the sphenopalatine foramen, which is right here, and it goes right up to the pterygomaxillary fossa, which is this fat-filled area, which then continues on as the pterygomaxillary fissure. Now look on the other side. Our sphenopalatine foramen opacified. Our pterygomaxillary fossa opacified. Our pterygopalatine fissure or pterygomaxillary fissure opacified. And our lesion is growing right along the back of the maxillary sinus, unfortunately transgressing and bowing the wall of the maxillary sinus anteriorly and going right out the free edge of the pterygomaxillary fissure, which narrows into the masticator space and the infratemporal fossa. So this is not good news in terms of staging this lesion. These are some key anatomic areas along with fat in the sphenoid bone. These are the pterygoid processes which form the posterior boundary of the pterygomaxillary fissure and fossa. Now, this is an important area because this is basically a railroad station. This connects the nasal cavity with the masticator space, with the orbit, with the orbital cavity, and with the middle cranial fossa. If we scroll down, we're going to run into the palatine bone. That is going to form the floor of the pterygomaxillary fossa. And even the pyramidal process of the palatine bone can be seen here. Now, if we go up, we're going to run into the inferior orbital foramen, which is right here. And on the other side, unfortunately, the inferior orbital foramen is opacified by our mass. So let's talk about the boundaries of the pterygopalatine fossa or pterygomaxillary fissure. The medial boundary is formed by the palatine bone. The lateral boundary is formed by the narrowing of this fissure into the infratemporal fossa and masticator space. The anterior boundary, well, that's easy. That's formed by the back of the maxillary sinus, which unfortunately is bowed and destroyed on the contralateral side. The posterior boundary is going to be formed by the pterygoid processes of the sphenoid bone and also the inferior aspect of the greater wing of the sphenoid. The roof, as we've already said, we go upwards. The roof is formed by the greater wing of the sphenoid bone and the inferior orbital fissure, which is right here, unfortunately opacified on the other side. And then, as already stated, the floor is formed by the palatine bone. So that is the anatomy of this area. I'll add one other caveat that's confusing to many of you young radiologists, and that is another pathway of spread, which is right here from anterior to posterior. I'm going to put some dots on it right here. And that's going to consist of the foramen rotundum and the Vidian canal. Now, that is not opacified in this case, but that's a pathway of spread from anterior to posterior, in contrast to the one I have arrowed, which comes out of Meckel's cave and goes down and then descends vertically the foramen ovale, part of the trigeminal nerve system. So that's a little, perhaps more than you wanted to know about the anatomy of this area. Let's move on now in the third vignette to the staging of JNA, or juvenile angiofibroma.